A lot of the work that we do is trying to understand better what happens to different types of healthcare interventions in the real-world setting. For us, the context of that is not just on a population basis, but also on an individualized basis. So when we look at the types of individualized data that's important to inform the research that we do that looks for differences in outcomes, we look at things like the patient's age. We often would like to have information around race and ethnicity that can often change what patients respond to which therapies, and is very important in that type of research. As we try to get to that information, it's not typically found in the data sets we have access to on a regular basis. So we work with our providers and with our membership, our patients, to try to gather that information so that that information can be factored in the research as well, so that ultimately the research and then the policies that follow that research can be informed by having better access to that information, so we can bring greater value to the populations that we serve. If we look at deriving the evidence, it's one part of the equation. So when we look to try to derive evidence on the heterogeneity of outcomes and trying to understand what works best in some certain populations and what doesn't, then that's only one part of the equation. The other part of the equation is trying to get that information in the hands of the decision makers, the physician, the patient themselves, when they need to make that decision. So one is knowing it, but the other is also trying to get it back through a very thick web of information back into the physician's hands, as an example of one of the decision makers that's often very difficult for them to do. So the evidence may exist, but often at the point of care, the physician doesn't have access to the information. So part of what we spend a lot of our time on is trying to help our physicians gain access to the evidence that's out there.